the live button, so we are live now. We were going to get started and let you join in. Oh,
We're
Dr.
live
Yamicia.
now. We're
Yep,
live now?
we are live. We are live right now in this moment.
We
And
can't do
this
Spaceballs? We can't do like then? When is now happening? Then.
reverse. But I'm so excited, and oh, the last time I talked to you, Dr. Yamicia Connor, I was so excited to get you to meet my friend Dr. Eric Lulov here. And my job is basically just to be like the guy that translated into what people that don't have medical degrees can understand. So I'll just kind of hop in.
Very important job.
Oh gosh, I'm finding I have all kinds of new jobs all the time.
Well,
But
Eric can act as our brunette interpreter.
oh well, I want to kind of just let you guys go and then just kind of like pipe in every now. Maybe I'll just raise my hand when it's getting to be too technical, so I can bring it back.
This is your show. You invited us. What the hell do you want to talk about?
All I want to do is get the people to know all you brilliant minds and to connect these brilliant minds. But how was your weekend, Yamicia?
It was okay. I have 3 kids, so every weekend is it's a weekend.
I have to run mine, but we were playing ultimate frisbee this weekend, get out and play, and they're getting big enough where it's like, oh, they wear us out. Mommy and daddy are all broken, but we were still managing to beat them because they don't know all the dirty tricks that I know.
Oh yeah, no, I'm glad. Like my 2-year-old his new thing is hiding and running. Like everything is hiding and running. And when I'm telling you he's a hider, my nanny was almost in tears because he is very, very good. And he's like silent. Most kids can't, they don't have the patience. He is very patient. So he will be there in some crevice for 10 minutes. Silent. It's actually very terrifying. It's my 5-year-old is who does the dash is after him now. When he just takes off going and mommy's oh my god, I haven't done a full sprint in years.
Oh yes. Oh, that gets you. I kind of miss the days when my kids were so small and they just always hide in the exact same spot. They just basically put the curtain in front of them so you could see their feet. That was so cute. They didn't fully understand hide and seek.
I'm empty
he's
nest
really
now,
into
so
it.
I don't have those days. I don't have these memories anymore. I'm totally empty nest. So.
Oh well, those memories never go away. But
yeah. I know.
So let's get into the topic of the day, though. And Eric and I were just going on. If you want to just talk about it for a minute, Eric, all these new studies that they've cut
So for everybody that doesn't know, I write for Blue Ant Media. I'm the contributing medical editor to Blue Ant Media. I do have a new article coming out that I'm gonna email to Lawrence to have it approved for publication, but it's titled "The Bill That You Haven't Seen Come Due Yet," and it's the result of all the NIH funding cuts and how cutting the NIH basically are against future medical bills and insurance payments and how it strains the system out. And just the fact that, and the data is from 2025, so we don't have any data yet from 26 because the Congress, there's some issues with the appropriations bill that they didn't pass through yet. So there's a portion of HHS with regard to NIH and CDC that hasn't been funded yet for 26. So, but going through the 25 data, there are approximately 3,300 less clinical trials currently active than there were in 24. And the gross proportion of them were cancer, reproductive health, cardiovascular disease, and infectious disease. Mm-hmm. Oh, and there's this thing called Ebola virus, and that's exploding right now. And we don't have a pandemic task force. We're not part of the WHO. So yeah. We're doing fantastic here.
Yeah. Well, what do you tell people about secondary insurance and the Medicaid cuts? Because that's one area that affects us, right? Because when something happens bad in obstetrics, it's real bad.
Oh yeah. Well, I do diabetic limb salvage, so yeah, it's even worse.
Yeah.
So, and the reality is that with people who are relying on Medicaid, and if you're in a state that did not do a Medicaid expansion, it becomes a problem. And what they wind up doing is they wind up going to the emergency room, and it winds up costing everybody more money because they're not getting preventative care. The whole point of preventative care is exactly what it means. It's to prevent shit from happening.
Yeah. Changing the oil in your car.
I wrote this a while back on our, my article regarding universal healthcare that, listen, treating everyday diabetes and treating everyday hypertension is boring as hell, but saves millions of dollars.
Yeah. Boredom is good when it comes to your health.
Old
That's
on
what
the
you
Yeah.
want.
Yeah, you don't want your team getting too excited. Like
No.
when they start bringing in like the rounds of
Right.
like
Yeah.
all the students and all the
Yeah,
residents.
oh,
You
yeah.
have
I've
the
never seen
fellows.
this
You have
before.
20 people in your room. Like that's not a good day on the wards.
This is my first time doing this. Is not what you want your doctor to be saying at all. Oh, man.
No, it's you don't want. And listen, the reality is, there's always going to be that portion of the population. They're going to have negative outcomes, right? They're going to have major limb amputation. They're going to have obstetrical emergencies. They're going to have cardiac syndrome emergencies. They're going to have neurological emergencies. There's always going to be that 1 to 5% of the population that's always going to be in that bottom part of the bell curve. What we're trying to avoid is the 80% having everything at one time because the system can't handle it. I can't. Most emergency departments are community-based hospitals. They're not big academic centers. They're anywhere between 130 to 200 bed systems, maybe 250. If they're lucky, they have a neurologist on staff. If they're even luckier, they have a vascular surgeon on staff. Most
A
of
lot
these
of luck
facilities,
compounding.
right?
Yeah.
Yeah.
Facilities, it's primary medicine. There might be a general surgeon in the area, probably not plastics. So that's a whole nother referral. I mean, like it gets to a point where they have these physicians on call, but they're not local. And with all the closure of rural hospital systems, it's really even more problematic where these patients now have to drive. I mean, even if you heard Marlon speak about his fractured ankle and having to get wound care services. And that's how he and I met, was just the conversation regarding his fracture blister and being on a wound vac. And he's put this out there publicly. It's not like I'm not violating HIPAA here, but um he had to drive 35, 40 miles to get to his clinics because of where he's located outside, he's 30 miles north of Wilmington. So, when you live in a rural area and there's been this massive push away from rural healthcare, and now you're talking gas at $4.50 a gallon. You think people are going to drive 50 miles to go see it? No. And now they've cut telehealth. So this is where telehealth would come in, where people don't have the ability to get care. And they're cutting that too. So
Yeah, I will tell you this. So I had an experience because I work in a lot of rural hospitals, and I had a routine case. Brought someone back. A case itself was uncomplicated, and they had a seizure, right? Because stuff like that happens. Like that's why you get consent, is because there are things that I cannot predict that are not part of the. And I will tell you. So of course, me, the OB, right? I'm, calling like my codes. I'm calling, and when the neurologist comes in, I promise you, they roll in this little computer screen, and it's a teleneurologist, right? That's all this hospital had.
no.
And so I was just like, "Oh, well, I guess I'm doing this. I guess I'm doing," and this is why they train you broadly in medicine. But that moment when you just realize, that
Yeah.
that the support, I mean, that, and I always tell people that the quality of your healthcare is two things, right? You need a good doctor, but you need a good health system. And I could be the best doctor in the world, right? But if you have a ruptured aorta and I don't have a vascular surgeon, I am there praying with you, right? Like we are both having a really bad day.
Oh, no.
Because
Because you're not going to get emergency privileges as a board
exactly,
certified
right?
OBGYN to crack open somebody's chest.
Right. Like it's just not happening,
It's
right?
not
Like
happening.
we're saying the sign of the cross together because that's it. That's all I can give you.
Yeah.
And so, or even more common, when you only have 4 packs of red blood cells in your facility, because that's all you have, and you're having a massive hemorrhage. And that happens. Like that has happened at least probably in the last 12 months to me, maybe twice. So it doesn't happen all the time, but it happens enough. And you are sending people are literally going in cars to neighboring hospitals to bring you back blood. That happens in our health system. And this was the before days, right? Now
Ah,
we have even less resources. And so I'm trying to get him to come and do some writing for us, but I was talking to an ED attending who, you know, him and his colleagues, are doing like vertical midline incision emergency cesarean deliveries in emergency rooms because there's no OB. And their thing is they're held to the same standards as an OB is in
Yeah.
terms of outcomes, right? Which is like insane, right? I mean, it's just insane. But that is a very bad day for everyone involved. For the patient, of course. But when you're having a vertical midline emergency cesarean delivery, that started off as a terrible day going into catastrophic.
I
You know,
that
this yeah, go ahead. So this actually brings up another part of the conversation, which we're talking about, like mid-level practitioners and the reliance of a lot of third-party publicly for-profit insurance companies that do not want physicians like you and I seeing patients. We cost them too much. We cost them money,
huh.
and they would rather have mid-level practitioners, NPs, physician assistants seeing patients because they can decrease the reimbursement rate because they're mid-level practitioners. But at the end of the day, they didn't go to medical school. They did not spend residency training. They don't have the requisite experience to deal with, unfortunately, the things that we train for. And
I
and this is what's it's become a for-profit system, and it's become extensively untenable.
One aspect I want to address, or you guys to address, is this idea of putting doctors into situations that they're not really prepared for and then holding them to this standard of liability. And we've already seen these efforts to arrest doctors, in cases, where there are draconian bills against reproductive health care. And I mean, this is just going to stress the system further where we have doctors, number one, afraid to perform surgeries, and then number two, potentially getting arrested. What are your thoughts, or what can you speak on that? I'm just having trouble. They just want us to all die in agony is really what it appears to be. I mean, are they just completely breaking the system from the inside?
I just don't think they what I did a lot of thinking about this over the weekend actually. And my conclusion has come either you're a complete sociopath, like you just don't care, or you just don't know. Like this is just not in your level of experience because I just don't see how you have a conversation with somebody who's literally telling you, we have had in North Carolina getting and this is not unusual. If you have mental like a child who needs serious mental health support, like those systems have been completely gutted, right? And so you have children living in emergency rooms, like living like months.
Yeah.
Like nurses are their mothers now. Like they take care of them, right? Months, I'm telling you. And these are kids, right? That the system has decided that it's just going to just abandon. And then you have another doctor telling you about like he is having to, you know, prepare his ED physicians with this training in obstetrics that they honestly you're only supposed to do those sorts of surgeries literally as a last resort, meaning someone has come in flatlined and you're trying to save the baby. Like that, the mother's not technically even alive,
Oh
right?
my goodness.
And you're trying to say that's what they train for, right? Because you want someone to be able to do that, right? Because even in a big hospital where you have every doctor, those minutes it's taking me to like, put on my scrubs, come out of clinic, like that's a difference between a live baby and a not live baby. That's why we train the emergency room physicians to do these really heroic, catastrophic surgeries. But that's not the same as a delivery of a live, a patient that you want to like who's alive, who
Well,
you need to deliver their
I mean,
baby.
are you
Like that's
talking
a
about? Are you
really
talking
different
about?
thing, you know?
Are you talking about cases where like the emergency room physicians are forcing the vertical C-section versus awaiting the 8 to 10 hours, taking up a labor and delivery bed in the ER for delivery, and they're
No,
choosing to do a fast
I'm
access?
no, well, I'm talking about situations where so they train for, someone essentially arrives through EMS. So just to take a couple steps back from the
The trauma
non-clinician
car
perspective.
accident where they need to get the baby out.
Yeah.
Right.
So let's
Okay.
say, somebody comes in, you were in a catastrophic accident. Terrible. You're a pregnant woman. Your baby is, 8 months, right? That baby can live outside the uterus. Um, your body may be able to sustain that baby's life for the time it takes the EMS to go, put you in the ambulance, drive you to the emergency room, and get you set up. But you're technically your body might not actually be fully able to be recovered. Once they made that decision, like the woman is no longer, for lack of a better word, viable. The all the efforts go into saving the baby, right? And what that require and often, it's also helpful for the mom because if you need to do a lot of cardiovascular resuscitation and you have a baby there, that baby's taking 20% of all of your blood supply. So in a stressed heart, in a stressed body, like, that's a lot of reserve. And so for many reasons, that baby needs to be delivered quickly. And so emergency room physicians technically have the training to be able to do in a very emergency, midline vertical, essentially open the abdomen, deliver the baby to try to get perfusion while the rest of the team is being mobilized, right? You have trauma surgery running because hospitals are big buildings, right? Literally, even if and doctors are even if you're on call, technically, you could be in the bathroom, you could be on the phone, you know what I mean? There's
Yeah.
you could be so many different places. It's gonna take practically time for the whole team to be able to mobilize and get down there. The NICU is grabbing isolates, right? Like, this stuff takes time. And so when every minute is like matters, the emergency room physicians will start that procedure. But that is a true catastrophic emergency, right? Those are the things where I tell patients, like, we have to be humble as physicians. There are things that we can prevent, and there's things that we can't. And the things that we can't prevent is what I call a real emergency.
Mm.
That's very different from I have no OB on call, and this lady needs an emergency C-section, and now I am somehow the responsible party for this situation. That's a very different scenario. That's a very different patient. That's a very different
Mm.
operation, right? Um, it's different in every way, right? And so you can't even equate the two. You can't just say, "Oh, this person can do," and maybe to a legislator or someone who does insurance, that might make some crazy sense to them. They're like, "Oh, this person knows how to do a C-section. Why can't they just do the C-section over here?" But
Yeah.
clinically, it's like literally saying, I know how to drive a car, so I'm gonna
Yeah.
do NASCAR, right? Like, that's not the
Yeah,
same
man.
like, that's not the same thing. Yeah, I know how to technically drive a car.
Yeah.
Does it make me, a race car driver, right? Like, those are different skills. And people are just so that's what I don't know. That's what
Well,
I hope
and
I leave.
and to be totally honest, listen, as physicians, we have allowed this to happen. We
Yeah.
have we have allowed our authority to be usurped by the C-suite.
Yes, that's very true.
And you have physicians who have chosen to not be in private practice. You have we they have elected to work for private equity companies that own groups that have basically eliminated a lot of choice for physicians in having any type of autonomy over their schedule, their lives. They have been reduced to a cash flow employee. And that as a physician, you have to generate X number of RVUs per patient visit or per calendar month or per calendar year, or we're gonna fire you because you're not profitable enough.
Mm.
That's this is they have relegated healthcare down to what we call an RVU or a relative work value. Every procedure we do, an office visit, a procedure,
Mm.
has a work value to it. And they look at procedures as profit-driven medicine. And the only way we fix this in the universal healthcare system is to basically remove the profitability out of doing procedures and switching it to prevention. But we can't do that because of the Social Security Act. We can't do that because of the Medicare Services Act. We can't do that because of the Administrative Services Act, all this federal legislation that binds our healthcare system that was
Yeah.
literally created as a reactive model.
Yeah.
You get restoration, you go to the emergency room, you get it fixed, you bill your insurance, it gets covered. Now it's gotten so inundated, overloaded that they literally had to create a system in place at the commercial insurance level, prior authorizations,
Yeah.
local coverage determinations, um, drug formularies, procedural formularies, and then now with Medicare and the government, you're seeing this with what they call the Wiser Project,
Mm.
which is it's an AI based prior authorization for certain services, and the companies that are managing these are the ones that are reporting directly up to Palantir.
Yeah.
So
Oh,
as if it didn't get any worse, like
yeah,
basically,
it's gonna.
these are seeing all of our healthcare data that's getting submitted to, especially Medicare, Medicaid that we deal with.
I
So,
just wanna say I don't think it's the doctor's fault. As I was listening to you, I was like, "This is a media problem," and it's like, this is where I can end. It's like, because I know, Eric, you've been working on these things, and I've been keeping busy, so haven't been able to attend all your lives talking about the
shame on you.
reality. Yeah, I
Bad
know,
for
I
you.
apologize, but it's just I am trying to pressure the media because we have a media that is they keep trying to normalize like all these conservative beliefs. It is the conservative belief they keep defiantly preventing us from even discussing Medicare for all or any kind of realistic reform. We haven't had our journalists haven't been coming into these hospitals to report on the things and the stress level of our poor doctors. So it's like the people do have at some point the messaging. I keep saying we have the data centers that use these corrupt algorithms to just hide the truth from us. I think a lot of the people don't understand because I'm in the media and the things you guys are just talking about now are like, oh my God, it's just sort of like, and after talking to before, it's like how the verge of collapse we're on. And it's like, okay, I'm in relatively good health, so I'm fortunate, and that's no excuse because it's like tomorrow something might happen to anybody and we have to have humanity for, worry about our other fellow human beings. And this
Mm.
ideology of selfishness, we're just indifferent to these decisions that cause torture, all these decisions, which are crimes against humanity, restricting reproductive health care, criminalizing doctors who save lives, and then creating a situation of such stress that our doctors get burned out and have to leave, which compounds it. So, I mean, from where you guys are sitting, I mean, how far away are we from complete collapse of our entire healthcare system here? Jimmy Chuck?
Who wants to? You want to handle the plutonium or me?
Yeah.
I think when you say complete collapse, I think the healthcare system will continue to function. I think what you're going to see is, um, first of all, the number one cause of bankruptcy in this country is from medical bills. That's going to get worse. Inevitably, it's going to get worse because of the just how everything is structured. I mean, even think about a person who's well insured, right?
Mhm.
A lot of us, our secondary insurance is through Medicaid. And so when you have someone, let's say, I get into an accident today that's catastrophic, a bus runs me over, right? We have good insurance, but eventually that insurance is not going to pay indefinitely forever. And so let's say I'm, in the hospital for the next 12 months. These things are not impossible, right? This happens to people. Well, for a lot of people, they secondary insurance needs to take over, right? Um, and a lot of that comes through Medicaid. And a lot of that is now, I don't even know what the status of that is right now. But that's really, when I tell people this is not just about, the poor, right?
Yeah.
We all depend on the system functioning,
Yeah.
right? Medicaid also pays for training of future doctors. Well, how is that going to work, right? Like you're cutting the very pipelines that you need to continue to fund the training of the workforce that you're losing. And then, you know, it's not going to be a big shock. Like, I tell people, like, you go on vacation, right? You go to your cabin in Vermont, right? You go to the woods in North Carolina, right? You're on the beach, right? Somewhere. Well, the Brigham isn't on the beach, right? Like, it's we all depend on the system working at scale, right? Because we don't know when we're gonna get sick. I don't know when I'm gonna have the chest pain that leads to the heart attack that requires me to be hospitalized. And so that's when you think about the system collapsing, well, there are gonna still be your medical centers that function, but they can only care for a small fraction of people. And the rest of the system is just gonna be let and that's what's been happening in reproductive health, just to be clear, is just there's just rot everywhere, right? There is, Title X funds right now. This is what gives teenagers birth control. This is what pays for pap smears for working women. This is what does STI testing so we don't have like killer gonorrhea out there. We have a syphilis outbreak right now, right? This is what does breast cancer screening. This is what does pregnancy testing and counseling for low income women. The the every time a Republican administration comes into power, they gut this these services every single time. And every single time you see the erosion. Even when you get full restoration of funding and you never get back to the baseline.
Yeah, it's already
And
damaged.
right now what's happening, even though Congress has appropriated the funding, they're overriding Congress. They're still denying the funding that is supposed to be going to these clinics right now, right? And so this happens, you chip away, you chip away, you chip away, you chip away. And eventually medicine is not like, it's not the type of thing that can be turned on and off. It's not an infrastructure project. It's not a building that just like you can go and commission a bridge to be built. And overnight you can see something this has taken the better part of the last 5, 6, 7 decades to put into place. And almost within, like, the last 10 years, it's just been completely demolished, and for what? For what? Like, really, like, for nothing, right? For pure stupidity, and it is, like, the
No,
things that we all depend on.
it's for profit. It's not, and I'm glad you brought up the workflow issues because this is where we're at. I mean, so just to kind of give people the 38,000-foot view of this whole thing. So at the end of the day is the US is really just a patchwork of regional markets. Our healthcare is just basically a patchwork of this health system, that health system, this health system, right? So the failure is more localized than it is systemic when we see failures in the healthcare system. And the academic medical centers and the urban hospital networks remain well capitalized, but the private equity and insurance sectors have strong financial incentives within those markets to keep enough of the system functional to extract out revenues. But to kind of reframe everything that she said is we're not there's really no single point collapse. I don't see this as a collapse system wide. It's not really going to ever happen, but we have undergone this very slow de-evolution where access and quality collapse is quiet in the rural communities, and it's in low income rural sectors of where we live.
Hmm.
And underinsured populations. It's the people they don't want to keep to even try to get healthy. They just want them sick, dead, and poor, and uneducated. Because when you can take out those people in the population, the other population becomes easier to control because they're being taken care of. So this is kind of like a really shitty way of bringing it's literally like Nazi Germany.
Yeah.
It's what they tried to do over a period of time in Nazi Germany. And what Franco tried to do in Spain and what Nero did in Rome years, like thousands of years. And how did it work out for all those guys?
Yeah.
They wound up dying alone somewhere in a bunker or in a sewer system right. But it's just the real danger is not the trash. It's the crash in the system. It's this permanent 2-tier system that we have. And it's really a 2-tier system of those Americans that can afford care and those that cannot afford care. And the ones that cannot afford care are deferring even acute care.
Mm.
They're afraid to go to the emergency rooms because what do we have now? We got ICE patrolling the emergency departments. well, you're an immigrant and you're not legal, so we're going to deport you, even though you're covered under EMTALA to stabilize you.
But let's also remind people, if you are, let's say, two equivalently rich people, I am rich here, I am rich there, right? I am rich. I can buy anything I want in healthcare. If I am a rich person in a country where people are healthy, I do better. Like literally, my dollars, I live longer, right?
Yes.
I just want to make that clear, right? We are connected. And so you can only buy so much health. That's the take home point, right? It doesn't actually putting more money into it, into your own like when you look at it at scale,
Uh-huh.
it doesn't make you healthier, right? It is better for you to buy the health of the people in that next town, right? Like that actually, because we're all connected, right? We are connected. We are
Yeah.
connected. So many things are
Well,
transmissible.
COVID exposed all that. That it didn't matter how much money you had during COVID. If you
Mhm.
got COVID, you got sick.
Yeah.
And viruses don't care about neighborhoods, and they don't care about borders. They don't care
Yeah.
about gated communities, and they don't care about what color your skin is or what socioeconomic class you live in. Okay?
And not to mention, we learn from sick people, right? Like
Yeah.
that is what clinical medicine, that is what medical research is, right? You learn from other sick people. Taking care of other sick people helps you take better care of the future sick people, right?
Yeah.
And so when you're gutting all of this research, okay, yeah, that's great. So, I mean, when your mother gets like that terrible metastatic pancreatic cancer, well, oh,
What
we didn't do any of that research,
But
like
this is
that, like
how
that stuff didn't happen.
but this is how we learned during COVID that putting patients in dependent Trellenberg actually did better for them by dropping their head and pushing fluid into their brain because of the virus that was caught. My son was like an anesthesiologist at Lenox Hill in New York City, ground zero. I mean, I was sending him PPE gear. That's how bad it was. I mean, they were stockpiling bodies in a truck outside the hospital because it was the alpha beta viruses. Remember how many people died? That really the
Mhm.
January, February, early virus disease. But we had no idea how to treat it. We thought, well, we should put them on ventilators, but it wasn't about that. It was about supporting the entire respiratory system, but doing it in a way that allowed these people to at least functionally breathe without the virus taking over. And that's how we figured it out. But people had to die and get very sick
Yeah.
to that point. And this is where I mean, we have all of the major polio vaccines, right? MMR, influenza, have all because people have gotten sick, and we have
Yeah.
blood titers. And I mean, Jonas Salk took blood from polio patients and was able to make an attenuated virus vaccine. I
The
mean,
what Well, one of the concerns is, I mean, you guys are painting this picture of this extremely stressed system, and we've got this ruling class that just has no aware of the consequence of their ridiculous choices that they're making. But what happens then? Yes, we get a new, like with coronavirus again, we get a new virus, the Weta virus or whatever, or the Ebola outbreak, like you said. I mean, how fast then? I mean, coronavirus should have showed us the problem of inherent to our system because we had to have this massive effort, which was completely outside of our entire ideology or philosophy of medicine in order to like get through that. And we didn't learn the lesson, or we allowed the malicious right to steal themselves back into power. What happens when we have a new type of, attack on the system that's already stressed? I mean, if we are hit by this really lethal virus, will that then cause our healthcare collapse? That I'm really worried about that after
well,
talking to you.
let's wind the clock pre Trump one, right? We had the Zaire Ebola and we had Zika virus. Both of those viruses were contained because the US was part of the WHO. And we were able to send our pandemic response units, which were funded, to those sites via the WHO to contain them at the source, right? Trump 1 comes in, first day in office, wipes out the pandemic response unit, rips up the playbook, throws the binder away. 3.5 years later, worldwide pandemic coronavirus. Now, it was only because of the research that had been done on the Human Genome Project with the CRISPR technologies that were being funded through the NIH that they were able to create a vaccine that rapidly. Okay. Moderna virus, the J&J. Okay. Those viruses were there because of NIH funding. So now let's fast forward 2025, cuts NIH $3 billion. They want another $18 billion out of the NIH for 26. They've cut the CDC. There is no pandemic response unit. We're not part of the WHO. Now what happens when boogie virus from Ebola comes and hits our shores?
Mm.
And it goes into a city.
And that's much more lethal, correct?
Yeah. I mean, that's not even, we're talking about
Catastrophic.
Because
catastrophic. You want to say catastrophic. Yeah. Yeah.
I'm sorry.
Like, it doesn't matter how much
Yeah.
money you have if you get Ebola.
No, it doesn't.
So-
And there is no
it is a
vaccine for this Ebola virus.
Yeah,
There's
it's
zero.
agony. I mean, it's the thing of movies, right? Like
Yeah.
that's what's on
Contagion.
the movies.
Well, our safeguard
Um,
for that were these containment strategies that the Republicans have dismantled. And so
Yeah.
we've just basically we're sitting here without any shield. And
Yeah.
so, yes, that'll be the destruction of our
National
entire.
security, Walter. Our public health is one of our national security pillars, and they've
Yeah,
pretty
absolutely.
much toppled the pillar.
Yeah, and that's why we have the framing of it. And just conversation is making me think we need to add more on the financial incentives out there. But that's why we have the framing that this is manufactured. Like what you are feeling, what you are seeing, they have created this.
Yep.
They have created this through years of chipping away at the infrastructure over and over and over again. And where I think the thing that has to change is we have to realize we need coordinated efforts across all sectors of society if we are going to build this back up, right? This cannot be, medicine and research. Like that's only one part of it, right? You need public health. You need the media infrastructure. You need,
Yeah.
education. You need. I mean, this has to happen. Otherwise, honestly, we are basically giving away our first
Yeah.
world lifestyle. Like that's what we have given them, right? Sure, things will be people will live, yeah, and people live all around the world, right? But we have so much privilege here, and we're giving it away, right? And so things like that you don't even have to think about as an American, right? Like it doesn't even cross your mind.
Yeah.
Well, I mean, we voted that away.
Well,
They've taken it from us.
yes. And look at how
Um,
much money, like on the lie of the oh, this is a threat. They never have had nuclear weapons in Iran. They weren't close to it. And we're spending all this money on that. But then like we've completely disregarded the threat of a super lethal, virus coming to our shores, which
Because
would
it's
wipe
not
out the whole
sexy
nation.
on Fox News for fear mongering.
I'm sorry?
It's not sexy on Fox News if
Oh,
you're talking about
geez.
Ebola virus over Iran. New.
what is it?
It's
We're
a
spending
Fox
$1 billion a day.
News.
Yeah.
We're
I
spending
mean,
a
but it's
billion a
like
day, right?
that's
So
I
let
want to
me
be
tell you what a
protected
billion a
from.
day is.
$2 billion.
For 2 bill. Okay, so for WIC, they cut $1.1 billion. That fed 1.4 million infant, toddlers, and pregnant women. Right, gone for one day. That's or half a day. Right, 12 hours. Right, you just told me. Head Start, $12 billion. That's
Mhm.
almost 1 million children.
We could have funded
Who?
the NIH for 4 years with the money that
Yeah,
they spent. 4 years.
Yeah. Well, it's just astounding to me because, okay, what was the lethality of coronavirus? It was, I mean, it was awful, but it was like the one silver lining was pretty low, right? The number of people that got it who ended up dying.
Well, not initially. The initial was that it caused massive respiratory dysfunction, which led into cardiac dysfunction and then eventual heart failure and, respiratory arrest. So that was the original. As the virus became more mutated, we got into the Charlie viruses, the Delta viruses, the Epsilon. I think by like last year we were down to Omicron. I think we were. It just was more like, but like every typical virus, the more it just there became more herd immunity through exposure. As people got sick, we developed it, but we don't hold on to antibodies for coronaviruses too long anyway. Coronavirus was never one of those big, like bubonic plague where it wiped out a third of Europe. It's not,
Yeah.
I mean, we had people die here because of misinformation, because of governors saying Oh, you don't have to socially,
Yeah, yeah.
protect yourself. You don't have to wear a mask in public. You can fly. You can get on an airplane and you don't if you want to be a pain in the ass and yell about wearing a mask for 2 stupid hours of your life, cause a problem. You know, um, and we have a and this is the same problem, right? We have a social media problem.
Yeah,
It's a
yeah.
lot of information. It's
Captured algorithms.
people getting their information from influencers, not scientists, certainly not licensed board certified physicians. Thank God we don't have a surgeon general like that. Finally, she didn't make it out of committee. That was the Casey Means issue where she was an influencer, not even and this is the kind of stuff that I know that Dr. Connor and I would have had an absolute conniption shit fit over, would be a surgeon general who didn't even finish her residency and who wasn't even licensed and never even like a day in practice saw a patient. We have somebody at the FDA who's a fucking turkey hunter. He's not even a physician. It's a friend of Donald Cokehead Trump Jr. Right? I mean, we have very
I think there's
unserious.
like a parody. Like they're just like messing with us.
Oh
Okay,
my
you
god.
you should see how like when people's like head like because you like like my
Yeah.
husband just told me
It's
someone new at the HHS. He's like a urologist, but he's not just like a urologist. He's like a penile implant specialist
Oh
or
yeah.
something like. And it's just like you're
Yeah.
just messing with me.
it's like watching a combination of SNL and Mad TV.
Yeah, exactly. That's what it sounds. It's
Well, like
like
the guy who
you're just messing
collects
with me.
he collects raccoon penises and shit. I mean, it's like, yeah, literally everything you hear is just so bizarre.
You're just like it's just like it's like someone is just like, I know what we're gonna do this
Oh.
time. I know how we're gonna get them, you know? I mean, because it's just otherwise it's so absurd. Like, the absurdity is part of the point, and
Well,
you just
that was their plan. The plan was to put unserious people in
yeah.
very serious positions whose whole charge was to basically break the system apart.
Well, that's you until you understand their theory, right? Because the whole point is to show that government is worthless, right? And so how do you show government is worthless? Like, part of it, because 'cause you're just, like, thinking, like, "Why would anyone wanna do this?" Okay, yes, if you want to get rid of the government and have as little,
Oh
checks
boy.
on your power and essentially go back to, this unitary executive theory, our equivalent of a monarch, well, how do you do that? Well, you put the most ridiculous people in every part of government, so government does become ridiculous, right? It becomes a parody. But it's just you like sit there, you read it. My husband, like sometimes I tell him, like, just I don't want to know. Like I
And
just
this
don't need to know. It's
and
okay.
this
I'm fine without that news brief.
What? And I keep going back to our media here, and everybody, all they do is react rather than respond. Even on Substack, where people are interviewing these, they're taking these things seriously. And it's like, well, I've been trying to interview the progressive, educated people that are running for office right now. Everybody needs to be doing that. We got to stop reacting to this
Right.
absurdity and start building and having a response. So we take these things back. We have to stop making apologies for these conservatives who are the ones who are deliberately trying to dismantle everything and get us all killed. I want to go back to one quick thing, though, just because I want to bring it back down to a level people can understand. What's your recommendation for a flight? Do you recommend just a mask or any other sort of every single flight, every time you're out in public, just as a general idea? Or what are your thoughts on that?
So I fly a lot. I'm platinum exec American Airlines. I fly a lot. I never wear a mask. I wash my hands. I wipe my seat down. I wipe my tray table down. I bring antimicrobial wipes. I try not to touch anything at airports, and it's
Okay.
basic hygiene. Everybody, it's wash your
Okay.
hands. Don't put your hands in your mouth. Don't let your kids roll on the carpeted floor at an airport. It's like God knows when the last time that
Easier
thing
said than
happened,
done.
right? Right?
Yeah.
I mean, it's airplane. It's a very, very, very public place. It's dirty. So just use your mobile phone, do contactless, check in, scan your boarding pass. Don't get a paper one that gets manhandled by 3 different people. Just be smarter about traveling. Just carry your own luggage on. Don't
Okay.
pack anything. Like travel lighter if you have to.
Well, the thing about wipes is really good. I hadn't thought about that. I suppose
I
that
don't I
doesn't
haven't worn a mask since the end of COVID, and
just a quick wipe of everything whenever
I
you're
just
going to
put
sit for a while, like
antimicrobial wipe. I wipe down my tray table. I
throw it
wipe the
away.
seat belt. I wipe the seat down, the seat in front of me, the armrests. even the window shade and the air control above. I just do a quick little decontamination wipe.
Yeah.
And honestly, the biggest one is just wash your hands. Go to the bathroom, wash your hands. You know,
Mhm.
it's and the flight attendants, if you ask them for like lemon with a napkin with some hot water, they'll give it to you. They're happy to do that for you. You just have
What's
to
the purpose of that? That's a
well, it's lemon and water and a hot like a hot like with a napkin or like a napkin from first class, like they'll give you a lemon if you want to go into the bathroom and wash your hands with lemon as an antimicrobial,
okay,
Yeah,
good.
the
absolutely.
citric acid. Um, but
Okay.
yeah, just travel with Purell and hand sanitizers and just
So just bringing oranges as a snack would be a good thing too, huh? As you're just, like,
yeah,
consistently
just don't leave the country with it
okay, yeah, I guess. Don't yeah, declare it at least.
because you
Let
can't
throw it
bring
away.
in fruits and vegetables somewhere
Yeah,
else.
okay.
But what's really disgusting is like some of the
A
people
little bit of
traveling
power.
with our
Yeah.
government are little parasites and they're allowed to enter other countries, but we can't. I can't bring an apple with me. But you always bring something back, but you can bring back chocolate. You can bring back Jamaican rum, you can bring back, duty-free stuff. You can
Yeah, yeah.
yeah.
And is it fair, that our pregnant women in particular are the first ones who are gonna feel the biggest impact the quickest? Or are there other groups? I guess disabled people, the disabled community is probably feeling a huge, terrible impact right now.
Veterans,
Well, yeah, yeah, anyone who has a compromised immune system, so pregnancy does it, right? That's one of the miracles of pregnancy is that you don't respond to this foreign body in you, right? And what that means very practically is your immune system is suppressed. That's a normal part of pregnancy. What that also means
Okay,
is that you're going to get sick easier. I'm a big fan of masks. I personally just do it because
okay,
I have small kids too, and I'm around a lot of other people with small kids, and I'm in the hospital rounding. I have just found, just anecdotally, I'm not giving any data out there. I just feel like I get sick less. Otherwise, I literally roll into one cold, into another, into another, into another, because I'm around a lot of young little kids, right?
mhm,
And they're always sick. But as he was saying, hand hygiene, Purell in your purse. I carry wipes everywhere I go because, again, I have little kids, and
mhm.
so constantly just
petri
running
dishes.
after them.
They're petri
Yeah,
dishes.
exactly. You're just constantly running after them, either cleaning up their mess or cleaning them up. And
And they
then,
touch everything.
yes, but a lot of it's common sense because honestly, if there's something very contagious, I mean, it's just
Yeah, yeah,
that's the whole purpose of public health infrastructure, is because there isn't anything you can do, right? If Ebola is gonna be on that plane, then, I mean, you know, that's why if you have religion, that's why you have religion, right? Like, there are certain things that, like, that are just beyond our control as humans, right? And you do what you can. Don't drive yourself nutty. You have to, like, you don't want to be a person that is taking things to extreme, and then support the infrastructure because the infrastructure keeps us safe, right? Because we know how to do this. We know how to do it at scale. And you don't
yeah,
do it at scale by just running around with Purell and mass, right? You
yeah,
do it at scale with surveillance. You do it at scale with science. You do it at scale with monitoring system. You do it at scale with communicating with the international body. We had a system that worked. We had problems in our medical system. Don't get me wrong, but it worked pretty well,
The surveillance systems during COVID
right?
were really, really good.
It worked pretty well. And instead of taking a system that worked well and making it better, we just decided to hell with it.
mm, mm.
Well,
Um,
we didn't decide that.
yeah,
Yes,
it
we
that
did.
well, and it's just the complacency, but it
White
is, it's the
White House decided to do that,
but
you
I've
know?
I've been on a tear about that lately because all of our algorithms, that's control, that's a control mechanism. It filters out the quality content, and everybody has been deprived of control. They
But
don't even
even
know where to
even
get
to that
information.
point though, even to that point, we have forgotten the history of how we've gotten here.
Mhm.
We have made decisions along the way as a society,
Yes.
right? We have made decisions that in order to build these platforms, you need VC funding. In order to have VC fundings, they need 10 to 20, 30x returns. In order to get that, I mean, it doesn't take a rocket science how you walk out the logic, right? How do you get that? Well, marketing, right? You have to sell people's attention. Well, how do you get people's attention? You talk to any, first year, psych major. Well, you make them mad, you make them angry, you
Mhm.
make them sad, you pull on emotion, you talk about racism, talk about sex,
Yeah.
put
Yeah.
women's breasts out there. Like, it's not hard to know
The
how to do
division.
this stuff.
Yeah.
But we made those decisions. And that's the thing that to me gives a little bit of hope is these are decisions that were made so they can be unmade, but we have to
Mhm.
do it. It's
Yeah.
not gonna happen, and it has to happen at
The
scale. It's not just the people
Yeah.
listening here, it's your cousin at home, who doesn't, care about these issues, your uncle, your aunt who's a racist, right? Like, it's all these people.
Yes.
They have to come to the table. Otherwise, like, this is too big of a project for any one of us. This has to be a collective, you know,
Absolutely.
a collective this is the biggest collective action problem
Yeah.
of our lifetime,
Yep.
and if we do not see it as such, the history books are gonna write about
Yep.
us, right? The history books are
Yep.
either gonna say we were the generation that just threw away the biggest rise of an empire, and in less than 20 years, we
Whew.
just demolished it. That's what the history books are gonna write about us
Yes.
if we do not fix this.
You know,
Correct.
real quick, Walter, I can't help but to think back to, the movie The American President with Michael Douglas. And, there was that quote in the climactic part of the movie where he's standing at the podium in the White House after he realized that he screwed up and wasn't communicating to the American people. And, the line was, we have serious problems to solve them. We need serious people to solve them. And I think the character was Bob Rumson. That was, I forgot who played him. It was, he was in American Graffiti and, whatever his name was. But he said he's only interested in two things. And this is what they're interested in. The GOP Republicans, you want to call them the Triple Kans, whatever you want to call them. Okay. They're only interested in two things. And they've only been interested in two things. And this has been their MO for 50 years is making you afraid of it and
Mhm.
telling you who's to blame for it. But they never tell you how they're going to solve it because they never have a solution.
Mhm. Mhm.
Right. Scientists like Dr. Connors and I were solution-oriented providers. We want to fix the issues, right? We want to help the patient get from point A to point B, healthy, vibrant, fix the problem. In her case, it's delivering a child, or women's health. In my case, it's diabetic health and wound management and making sure patients keep their lower extremities. We all have a purpose, but we're solution-driven, science-based people. When you elect people, consequences have a lot, elections always have consequences. This one, I think we'll come back from this one. I think the American people are going to eventually snap back. The pendulum swung too far the opposite direction. And there's always a thing in U.S. history and our American history, regardless of whether you're taught the entire U.S. history or you're only taught a short portion of it, that there is always a rebound effect. For every, who is a scientist? Again, back to science.
Mhm.
It was Newton, right? For every reaction, there's an equal and opposite reaction. Well, there's going to be an equal and opposite reaction to what we've been living through. And that's what they can't fucking stand. It's the fact that they know that it's coming. So they're doing everything they can now to cheat and steal their way to prevent that from happening. But you can't stop a runaway train.
Mm.
You can't. They have done exactly what I just quoted. Okay. They have made us angry about it. And when
Yeah.
when you do shit in politically that you activate a population and you've made them angry, action usually follows. People just don't get angry and then nothing happens. There's always an action to it,
Mhm.
right?
Mhm.
We saw this. We
Unless
saw
they're all dead,
this
based
during
on what's happening.
every portion in American history. There's always been an equal and opposite reaction to a lever of power that's been pulled too much in one direction.
Mm.
And listen, there's going to be a judgment day here coming. And
Yeah.
I mean, we could sit here, but our job as the Substack creators,
Yeah.
okay,
Well, yeah.
as the physicians and the scientists, we have the ability to message to our viewers, to people that subscribe to us, that follow us, that hear what we have to say, we can be the stimulus of hope and provide that leadership for people that need guidance. And that's kind of the role we all have to play now.
Dr. Connor?
Yeah, I was just looking in the chat, and someone said the Supreme Court has tied us to the tracks, and that's
Oh,
very
boy.
true.
Yeah.
And that, I agree there will be a turnaround, or I mean, at least I pray, there will be. But the tail of this effect is going to be dictated by how vigorous of a response we all have now.
Mhm.
And there is real damage being done. And if people do not help, media, yes, I think has a huge role, but everyday people need to bring these
Yeah,
conversations
easy.
into your everyday life
Yes.
because it matters. This
Yes.
this is the take home point. What is happening right now affects every person here materially. I don't care who you are. You are affected by what is happening. You have a stake in this, right? You
Yeah.
have a real stake, not in the abstract, like democracy, hypothetical arguments. I'm talking about right now
Life and
because
death.
they are stealing your future right from underneath you.
They're
Like
stealing your
it's
health.
Yeah.
it's gone. Yes. The lunch for the first grader is gone. The if you have a child with autism, their resources, their actual education, their ability to make anything of their lives being stolen, gone. Disease surveillance, gone. Your
Mhm.
IUD, they're trying to take away. They're trying to take away formula from growing babies, right? They are stealing, adding to your premium. Like your every one of us, look at your bill. Don't just,
Yeah.
don't just, pay it, right? Look at how much it has gone up. It's
Yeah.
somewhere between like 14 to 25%,
Yep.
depending who you are. That is money that's coming out of your pocket that they are taking from you, right? And then to put it all like to put a cherry on top, they're making it so your medical records can be used by for that your doctor writes down can be given right to the police.
Mm.
Oh, no, it's already happening. It's already happening. That's already being done,
Yeah.
by the
Well,
way.
I just wanna say it's clear, our cultural identity is literally killing us. We have to make that radical change. We have to embrace, we have to find the courage to understand, because 'cause they're always like, "Well, this is our tradition, and this is the way it's always been, and we need to have pride." All these things that they say to justify racism and cruelty, and we just have to have the courage to understand the traditions of the past are not
Yes.
working on modern reality anymore, and those words have always been to hide racism and abuse against humanity, and we just have to stop being in that rut, that mindset where we make apologies for the abusers
Yep.
and we actually demand that we have a
This is what I try to tell people. You cannot hate anyone more than you love yourself, right? And if you are supporting this administration, that's what you're doing. You're letting your hatred be much more powerful than your love for your kids, your wife, your mother,
yeah,
anyone who is close to you. That's what you're trading. You're trading their future. This has nothing to do with me and my brown skin or my brown kid, right? Like this, look at your family. Look at the
Oh, she's
portraits in
brown?
your house, right?
She's brown?
Right? And that's what I think people have failed to see, right?
yeah,
And it's because so much of the advocacy is done by, us like far left, crazy people or minorities or women, right? That it has been. I'm not talking about just my family right now, because honestly, we have plans to like, if things get really bad, like we
yeah, yeah, yeah,
we will leave. Like, just I have 3 kids I have to raise. I'm sorry. I will continue to fight from abroad, but we will leave. I'm not gonna let them be, because we keep our ears on the ground, right?
yeah, yeah,
And so I'm talking to people, this is your life.
yeah, yeah, and all those cultural traditions though that keep people and the divisions that are created. Somebody, it was Annalisa Bruner, just said that they deliberately are breaking up our kinship, they're breaking up our families. All that's been by design too. All these families have separated and gotten into these fights to enable this hostile takeover. But we're at the end of our hour. Thank you guys so much for being here. And I was just like, yeah, like I said, just trying every now and then pipe in to just bring it back so that the people can understand. But
Thank
it
you
was
for
it was
having these
beautiful.
conversations.
No,
So
this is great. Like this is an important conversations to have, not just weekly, monthly, but this is a daily, just even if it's a couple minutes to
Mhm.
reach out to somebody, say,
The
hey, how
reality.
and honestly, the simplest thing you can do is go through your phone list. Is there somebody you haven't spoken to in a while that you like, you keep saying to yourself, I need just reach out and say, hey, just thinking of you, saw you in my phone list, haven't said hi in a while.
Yeah.
Just
Yeah,
reach
that's a
out
nice
to
one.
somebody.
Those are nice
And
messages.
I think we need to reconnect to each other outside of digital.
Yes.
It's okay to send a text message, but we need to teach our children how to communicate like this, eye to eye. Like it's I mean,
Yeah.
I feel like I could sit across the room from Dr. Connors in the doctor's lounge at the hospital. We would just have this great conversation for like an hour, and we both look
Yeah.
at our like, "Shit, we're 20 minutes late to class."
Yeah.
yeah, exactly. And you're
Right?
like, oh
Yeah,
man,
right?
Oh,
I'll be paying for this all night tonight.
well, I'm
But
so glad. Oh, go ahead.
I love the fact that we have this ability in this medium to do this today
Yes.
and to
Yes.
reach 164 people who have joined our chat, and we really thank you for sharing your hour with us or whatever little time you've given to us
Yeah.
to do this. And thank you, Walter, my friend, who put this together. And, you know, of course, it's always a pleasure to share the screen with such esteemed people. So
Well, you're so wonderful. And yeah, and I wanted to double check your webpage. I've been sharing it, laboracollective.com. Dr. Connor,
Yes,
so people can
yes,
find it.
yes.
Anything else you want to direct people to?
Yeah, and we're doing a lot to try to help provide resources for people to actually help get the word out. We have if you go to manufactured .laborcollective.com, we have our basically our argument that we are making, and we're going to continue to update that like every few weeks with the new data about what's happening in the reproductive health space. I'm going to add after this conversation, I want to add the dimensions around the financial pressures, right? Because yes, this administration is responsible for a lot, but a lot of the ground it's not independent from the economic pressures that are really driving, a lot of these changes as well, right? And so we want to add that element in there, and we want people to help spread the word because we
Mm,
cannot in the
yeah.
birthing world. We are in real crisis, regardless of what happens today. Even if you know, hopefully people vote the right way. Hopefully things get better. Regardless,
Mhm.
the birthing world is in really poor shape. We have a birth worker crisis that is coming. It's simply coming. And we have a system that is not prepared. And
Mm,
that's the thing that keeps me up at night, is in 5 years, you're going to be hearing horror stories of people delivering against their will on the sides of roads, in emergency rooms, ED physicians having to do these emergency procedures because there simply are not enough obstetricians. We are losing another 5 to 7,000 bodies, right, in an already constrained system. That is something that is going to have an impact. And so we're doing everything we can. And we just need help spreading the word so that people understand what is at stake, because what is at stake is
yeah.
our future. Like, what do we do any of this for if it's not for our kids, right?
Yeah.
What does any of this matter if it's not
exactly.
for them, right? And we're not providing the infrastructure that they need to even begin their lives
Yes.
healthy, right?
Let me add something, just something a little bit hopeful in the end there. I'm about to make the transition where I've been interviewing a lot of candidates, but in my district, Emily Bergey's running. I've signed up. I'm going to start hitting the streets now. And everybody, I want you. I've been doing all these candidate interviews. Find the one in your district, a progressive. Doesn't matter if they win or they don't win. Just be involved with that. Be involved with that community. Tell people about that. Learn the language, the things we have to say, because the media has been captured. It's critical for all of us to be individually educated on these things and to tell as many people around us who trust us what's really happening. We have to take these things back and we have to support, but it's in your community is the biggest place you can make an impact right now. I guarantee there's a progressive challenger. There are progressive candidates, whether it's for Congress, whether it's for school board, whether it's for local community level. Just get involved with these campaigns, get involved with these people. We have to take back our entire political dialogue. We have to make it so the media can't disregard the fact that women are being, they're being subjected to torture by our country right now, and it's going to expand to all these other groups as well. And we can do that. But yes, this is where you feel empowered, face to face with people in your community, working to elevate the good leaders. Final thought, Eric? Well, that was a good one.
No,
I'm like a
I'm
big
just
smile out
kidding.
of the
No, I just want to reiterate everything that Walter said because, like, for example, like this evening, I interviewed Victoria Doyle last Wednesday, so I am actually going to her event this evening
Awesome.
in Palm
Fine.
Beach. She's got a couple guests that are going to be speaking, and you can get involved. You don't have to donate if you can't afford it, but you can volunteer your
So
time.
much. So
There is nothing more, and I think Yamicia will probably agree with me, Walter. I know you'll agree with me. You guys have heard me say this before. The one thing that we have that is more valuable than anything we own is our time.
Yes.
Okay.
Yes.
And for those of us on the other side of 50, we have less of it in front of us than we do behind us. So it's real important to make sure that we use our time wisely and that time is invested the way we choose to invest it.
Yeah.
So it's going to take a community to break what's happened.
Yeah.
And we can do it, but we just have to be smart about how we do things with our time. And it's easy to bitch and complain out behind a computer. Get off your ass, call your local congressperson, your
Yeah.
congressional candidate that's a progressive that you identify with and say, how can I help? I can't donate, but I can donate my time. I can give you 8 hours a week. I can do a phone bank. I can
You can
do
drive a car if you don't want to go door to door. You can drive.
I mean, well, especially if you don't wanna drive, you can walk. I mean, I understand
Mhm.
gas at 4.50 gallons, ridiculous, it's insane.
There's
But
so many ways. Yeah.
there's so many ways that you can help your local candidates, not just for congressional and national, but state, local, school board, parks and rec, water management. All these little elections mean everything because they change policy in your backyard that has an effect on how you live. It's not just in DC. So anyway, with that, Walter, I
All right.
guess I will see you Thursday for our show. Thank you for having me.
Awesome. Oh,
Everybody follow me here on Substack and at blueampmedia.co. You can read my stuff. I have a new article publishing on the bill that's coming that you is the bill that's due that you haven't gotten yet. So it's about the NIH funding cuts and how that affects our future healthcare spend. And Yasmira, thank you so much for meeting it. I did subscribe to you in the middle of the show. I was able to do it. I can multitask.
and Dr. Micio, any last thoughts?
Just thank you.
Oh,
Thank you for
thank
the
you.
opportunity to, spread the word. And, if you have, what I tell people, anyone who has a reproductive age woman or someone who's gonna be reproductive age in their household, this is an important
Oh,
conversation. Don't let it be that you're thinking about these issues when she is bleeding in a parking lot somewhere. Like, do not let that be her future. We all have to work to protect these women. We're doing as much as we can, but trust me, I mean, we're swimming upstream, and we're barely staying afloat sometimes because there's so. If I gave you the statistics here, it would just be me rattling off terrible thing after terrible thing after terrible thing after terrible thing. Like literally, that's what it is. And so we need your help.
thank you. Well, you guys, I really appreciate both of you guys so much. Yeah, we just need more people. We'll get as much word out there. We're not done. We're not going to quit. We're not going to quit
We ain't done.
fighting.
We're not
We
gonna
ain't
quit.
done.
I mean, that's what I tell people. I'm like, well, I might die trying.
Oh,
that might
yep.
that might be the outcome. I'm
Honestly,
not taking it off the table.
unfortunately, 6 weeks from now, it's our 250th anniversary as a country. Okay. What happened 250 years ago? Goddamn, we had a fucking revolution. We put
Yeah.
fucking tea in the goddamn harbor and said enough's enough. We
Yeah.
need to
Yeah,
throw the tea in the harbor.
Yeah.
Enough's
For our
enough,
kids, for our
right?
future.
yeah,
Yeah,
And
absolutely.
for our kids' future, for our future, listen, that document's 250 years old. Doesn't mean we have to throw it in the trash, but we do need to fix it.
Yeah.
yeah.
And
Oh,
we have got
yes,
to fix it. So
yes.
Awesome. Oh, thank you guys so much. I appreciate you. I look forward to more talks with you guys and for listening to you guys talk too. So I'm not the speed bump that keeps you from. Loved it. Loved it. Thanks everybody in the chat. Please make sure you share. We'll say
everybody,
bye to you
thank
guys.
you.
Thank you.
Bye bye.
Bye.
I can get it.